Hello, welcome. Thanks for being with us. Today is November 14th, World Diabetes Day. Our newsletter Jdc Diabetes Gems was started exactly 1 year back. What is the good news on diabetes? Diabetes is 100% preventable. The complications of diabetes are also almost 100% preventable. And how is it possible? It is only through education, education, education. Here you go with 4 tips. If you are overweight, if you are having an LDL cholesterol, that is bad cholesterol, of more than 130 milligrams per deciliter, or if you are having a blood pressure above 140 by 90 millimeters of mercury, you are more prone for developing diabetes. And you have to avoid the risk factors or treat the so-called risk factors like hypertension or hyperlipidemia with drugs if necessary. What if you are having diabetes? Diabetes can be detected very early with the help of some new investigations. A casual blood sugar investigation can miss the diagnosis of diabetes. If you can go for an HbA1c, especially if done via an HPLC method, which is the gold standard, you will get an accurate report on the average of the past 3 months blood sugars. And if the HbA1c value is 5.8 or more, you can have a pre-diabetes-like situation. And if the HbA1c value for you is 6.5% or more, it is almost confirmatory of diabetes diagnosis, provided it is done in a very good laboratory with quality control. And if you are on treatment for diabetes, then what are the tips? Number 1, you have to be on periodic physical and lab evaluations. Always use glucometer at home. The technique is called self-monitoring of blood glucose. Self-monitoring of blood glucose will give you a data on sugars before the food, 2 hours after food, before going to bed, etc. etc. Polypharmacy in diabetes is mandatory if you are to prevent the complications in other vital organs. Exercise should be a daily affair. Brisk walking, swimming, cycling, dancing, all are good. Before you start exercising, discuss with your doctor, dietitian and the diabetes treatment team on what sort of an exercise and what duration will be most suitable for you. And when you are treating diabetes, make sure the targets of therapy are not only achieved, but they are sustained. The good news about diabetes is completely preventable. Diabetes can be treated in the best way possible because of the lot of new drugs which are available now in the market, newer therapeutic options and technologies which are emerging in the market. But once diabetes is diagnosed, never ignore it.